Good morning, everyone. This is Shelby Walker with the Tennessee Department of Health. I have 11:30, so we will go ahead and get started. Thanks for joining us this morning, and thank you for bearing with us as we had to change the time. We will be hearing remarks today from Tennessee Health Commissioner Lisa Piercey. We also have joining us today Dr. Michelle Fiskus, Director of our Vaccine Preventable Disease and Immunization Program. Once Dr. Piercey completes her remarks, we will have time to take your questions. We will be using the raise hand function. So if you have a question to ask, please do that, and we will call on individuals in the order in which they appear. If we have more than one individual from the same organization in queue to ask questions, we will take other outlets first to give everyone an opportunity to get their questions in. This information that you will hear today is all on the record. You may record this briefing and you may stream it if you wish to do so. Please also check your email. We have provided you with some documents along with the WebEx information, so please look for those attachments. If you did not receive them or had any trouble with the attachments, please email me and we will be glad to get those to you. Dr. Piercey, we are ready to begin.
Thank you, Shelley. Good morning, everyone. I have a lot of information to share today. It is very technical. There are a lot of details and dates and numbers. If you haven't done so already, I would ask that you have the document that is attached to this WebEx invitation in front of you, because I will be going through that in just a minute after a couple of opening comments. So my top line today is to give you an update on the investigation into the Memphis Shelby County situation that I first briefed you on Tuesday of this week. But before I get into that, I want to just set this in context. We're talking about one county out of 95. We've got 94 counties that are doing really well under difficult circumstances. That includes our 89 rural county health departments. We get compliments every single day on how well they're serving their individual communities. And that also includes the 5 other metros who are doing a stellar job. We were just on site in Nashville at the metro site earlier this week, and we're very impressed and quite frankly inspired by what we were seeing. So I just want to set that context that people are doing it right, and I don't want to lose sight of that. The other people that are doing it right are the city of Memphis. They stepped into the gap and have responded quickly and quite effectively and are doing a really good job of that. And so I applaud them for taking charge of that situation. So I want to brief you on what I learned from the initial team that came back last night from being in Memphis all week at the Shelby County Health Department. They switched out with another team late yesterday. And so there's a second team on site as of this morning. And the governor and I were briefed this morning by the lead pharmacist that was on site for the week. One of the things that he mentioned this morning that I thought is a good summary of what we are dealing with is he characterized Shelby County Health Department as a low accountability organization. You have heard me talk about, and you now have documentation that there is a lack of processes. And the other thing that we found that I thought was unusual that I believe is contributing to this issue is that every health department has a team of vaccine experts. It appears that their normal team of vaccine experts in Shelby County were not in charge of the COVID-19 vaccine response. I don't have a clear rationale for why that is, but that certainly is something that we've initially identified as contributing to the problem. In the packet of records you received, you will see an example of some of the documentation that was provided to us. I will tell you that I recognize that many of you are in the process of open records requests, and we will respond to those fully. That is going to take some time, but in a good faith effort, I did want to provide a sampling of some of the communications, particularly since February 19th, related to the expired doses. Before we get started with the timeline, I alluded to it a minute ago, but I want to remind you about how our state's health department is set up. And when you've seen one state health department, you've seen one state health department, because they're a little bit different all over the country. The way it works in Tennessee is that our 6 largest population centers, our 6 metro counties, those are somewhat autonomous. Somewhat, I say, in so much as they are collaborative partners with us. We provide them with support and training and technical assistance and expertise, but they do not report to the State Department of Health. They report to their county governments and are freestanding health departments on their own. That is opposed to the 89 rural health departments. So every other county besides the largest 6 do report to the state health department. So it's a bit of a unique situation. Like I said, every state is different, but I wanted you to have that context. The other thing that I wanted to fill you in on is just because they're autonomous and because they report to their own county government and not the state health department, that doesn't mean we leave them alone to figure it out on their own. We do provide frequent touch points and as I mentioned, training, education, and support. And more recently, when we have been dealing with the COVID-19 vaccine, we've been hosting bi-weekly calls as well as what I term rolling deep dives. So we go through and dig in to each of the metro health departments, specifically as it relates to COVID-19 vaccine, and say, okay, how's this going? And what's your process for this? And on down the line. We just did that again, as I mentioned a minute ago, with Metro Nashville within the last week. And we were very impressed when their team just came out immediately and said, here's our process, here's our record keeping, this is how we report it, and very swift response. We are seeing that, I just used Nashville as an example, we're seeing that statewide in our metro health departments, except for, unfortunately, Shelby County. We also offer open office hours on a weekly basis. If health departments don't feel comfortable sharing in that group venue where we have the bi-weekly calls of all the metro health departments, we have open office hours every week with our leadership. If they would like to call and talk through an issue more one-on-one in a private setting, we have that availability. And then there are just multiple personal touch points with members of our executive leadership team. Specifically, Dr. Fiscus, that you've heard from before, she runs our vaccine program. Dr. Tim Jones is our chief medical officer, and then of course myself. Every single one of the health officials in the metro counties have my personal cell phone number, my email address, as they do with Dr. Jones and Dr. Fiscus, and we communicate on somewhat of a regular basis. And there's no question of how to get in touch with people when you need that. So now I'll transition to the timeline. And if you don't have it pulled up yet, I would ask that you go ahead and do that, because there's a significant amount of detail herein. And at the expense of just reading it off to you, I do want to highlight some things and add a little bit more detail and clarity to some of the items. So before I get into this, I want to remind you that this is a working draft. You've heard me use that term before about our vaccine plan. Anytime we have a document that we continue to learn information about, we will add it as we go. We already know there are other milestones that need to go on this timeline, but it became clear within the last 24 hours or so that there are a lot of dates and milestones swirling around out there. And so in an attempt to provide you with some clarity, we wanted to put this together to give to you. This will be updated as we go along. So probably the first action I wanted to draw your attention to came in late January. That is when we as the state, through the TEMA organization, first requested the 26 FEMA personnel. Those FEMA personnel were requested on Wednesday, January 27th, for multiple reasons, but one of the primary reasons is throughout the month of January, we started to see in the system that we use, it's called Tiberius, we had been seeing that the inventory was growing. And you've heard me reference even in this very venue on multiple occasions, when we talked to Shelby County about why that inventory was growing, the repeated rationale was that they had a backlog in documentation. You will remember that this issue came up in mid to late January when there was some concern that Shelby County wasn't getting their fair share of allocation. And part of the reason that that was feared was that the administration numbers weren't matching with what we were saying the allocation was. And the delta there was that inventory on the shelf. And so when we started asking questions about that, we were told that it was a lag in documentation. And so in an effort to be responsive, one of the actions that we took was to deploy FEMA staff from the federal government. 26 of those went to Memphis. You'll remember that another 26 went to the Nashville site also for logistics and on the ground help. So when we, after we requested the FEMA personnel, we immediately said, we probably need to come on site, well, right now, virtually on site in a WebEx, and do a strategic planning session with you. So we scheduled that on February the 1st. That ultimately took place on February 5th. So that was a Monday to a Friday of that same week. In the middle of that week, the FEMA staff, beginning with the leadership and then with the personnel, came on site, and everything was percolating along for a week or two, or so we thought, until we continued to see those high level of inventory numbers in the system. And after a week or so, we started becoming more concerned, because if the backlog was being taken care of through these FEMA personnel, that inventory number should start to go down. Well, we didn't see that. So we started asking additional questions, and we're continuing to get somewhat vague answers, or continue to be told that it was a delay in record keeping. I personally had a conversation with Dr. Haushalter on February 16th. I believe that was last Tuesday of last week. And I asked her about the inventory. She did again say that some of those were documentation backlog. She also admitted that she wasn't for certain how many doses were in inventory. She offered to get the pharmacist to come in to count those. The pharmacist was not on site that day. You'll remember that was a snow day. And so that was the conversation at that point. Excuse me. So on February 19th at 10 a.m. Is when the first documentation came from Dr. Haushalter to Dr. Jones about the expired doses. Some of these next few lines you already know, because this is what we covered on Tuesday in the briefing. And then I also want to make one note on here, just for reference throughout the rest of my comments. The Shelby County Health Department reported 1,315 doses. That is noted on my sheet as 1,578 doses. You will recall that around that same time is when the FDA changed their packaging, that their vial contained, used to be 5 doses and now 6 doses. So we're talking about the same number of vials. Shelby County Health Department was calculating it with 5. We calculated it with 6. It was not inappropriate to calculate it as 5 because the first events were prior to the packaging change. But the rest of the numbers in the document reference the 6 doses per vial. So I just wanted to clear that up. I won't mention that part again. As you know, once we were alerted to the expired doses on that Friday morning of last week, we deployed a team who arrived at around 7:30 that night. The next few line items are things that have already been reported. We confirmed 1,578 expired doses. We also hand counted 51,480 doses in inventory. Our team met with Shelby County Health Department the following morning and then left around lunchtime. Over that weekend and on Sunday, I formally requested on-site assistance from the CDC to bring a subject matter expert in vaccine storage and handling on site. You have a copy of that letter in the documentation packet you were provided today. I did get word late last night that they do plan to send a team on site. I don't have an estimated time of arrival yet, but I was confirmed that last night by CDC. On Monday at around lunchtime or just after lunch, our team arrived on site and began the deep dive process of looking at the records, assessing the processes, and interviewing people on site. For the dates of Monday, Tuesday, and Wednesday, you will see repeats on this timeline. The physical inventory remained at Shelby County Health Department on those dates and was physically managed by our pharmacist, who also happens to be the director of our emergency preparedness division. On Monday, February 22nd, in the course of conversations, we had gone through multiple iterations of, is there anything else you want to tell us? Is there anything else we need to know? And we weren't disclosed anything until finally we reminded them that there was likely going to be a federal investigation. That is when the additional 840 doses were disclosed on February 22nd that were wasted or expired on February 15th. That was not disclosed on the 19th when we were there. That was the first indication that we had that gave us some pause about being forthcoming with data. And so we just made a note of that and we're concerned about that. So again, on the second page of this timeline, you'll see that we continued to manage the inventory personally on Tuesday. And then another issue happened late on Tuesday. This actually happened late into the evening on the 23rd. It wasn't discovered until early morning of the 24th, but the actual event occurred on the 23rd. That's why it's on the timeline of that date. And what we found is that when some doses came back from pods that were occurring on that date, there were at least 64 physical syringes that already had vaccine drawn up in them that were returned to the health department. The inventory log made mention of 76. We only had counted 64. The additional 12 are unaccounted for. Nobody appears to know where those 12 doses were. Now, I will make mention now, because it comes up again later in the timeline, this does indicate that there is a problem out in the field, out in the distribution process, at least at the Shelby County sites. And I described that to you earlier in the week, that we're sort of dealing with two buckets here. One of those buckets is the allocation and management. If you want to think about it, it's what goes on in the office or in the pharmacy. That's our primary focus of work right now, because that is where doses get allocated in the hundreds or in the thousands. And so that's the focus of our work. As I mentioned to you on Tuesday, we also recognize that there are problems out in the field where administration is going on. We do think those problems are much lower in number and in significance, but we do acknowledge that they're there. And as I told you on Tuesday, that is in our action plan to start addressing those, but we have to address the bigger problem upstream first. So these 76 or perhaps 64 doses that were wasted in the field came back after a pod saying that they were excess doses that were unable to be used. They came in late in that evening, and when they were discovered early morning on the 24th, they had already expired. So that added to the count. Again, on Wednesday, we physically managed the inventory on site, But an important shift happened on Wednesday morning around 10 a.m. We had a joint conference call. Dr. Haushalter, Doug McGowan, I believe Mayor Strickland was on that call. I can't recall. Myself and members of my team. That is when we officially gave the authority to the city of Memphis to begin directing and allocating, as well as transporting and being responsible for storage of that vaccine. The city of Memphis had some immediate needs, and I'll tell you about how we responded to those. But the city of Memphis is contracting with both Regional One and with Poplar Healthcare to store their vaccine. So Regional One is storing the Pfizer product for city of Memphis. Poplar Healthcare is storing the Moderna product. Those doses, those vials, were physically moved over the course of Wednesday and Thursday, the 24th and 25th, to those respective locations. The other thing that we quickly identified on Wednesday that City of Memphis still needed in order to be able to take doses out to the different sites are what we call digital data loggers and transport coolers. These are important terms because these are some issues that we have not yet been able to resolve with Shelby County Health Department as far as where their data is from those data loggers. Just to give you a high-level overview, a digital data logger is essentially a digital thermometer that goes on the side of either a static refrigerator or a transport cooler, and it has the ability, at least the ones I'm personally familiar with, where you push the button on it and it automatically uploads the data for all of the temperature to the computer. And then it does store some in the memory, but you have to download it on a pretty frequent basis to clear the memory and to continue allowing it to function. This is a really important step because we have to be able to maintain or demonstrate the integrity of the temperature throughout the cold chain process. So from the very minute it leaves the factory or the distributor, all the way through transport to storage in a health department, then to transport to the site until it gets in somebody's arm, we have to know the temperature all throughout. I will tell you that that is one of the significant issues that we are having right now with Shelby County Health Department. We are not able to get a full set of that data. Some of it has not been provided to us. It appears that the vast majority of it was not preserved. And so right now our team is working feverishly to try to mine the data that we do have available to us and put all of the pieces of this puzzle together so we can ensure the integrity of that cold chain temperature all throughout the process. So sorry, got off track there. Back to the timeline. Let me tell you about the really heroic and swift efforts that occurred on Wednesday. It was so impressive, and I am so proud of our partners of both TEMA and the National Guard. So when I got off topic, I was talking about digital data loggers and the transport coolers. These are very hard to come by, particularly the transport coolers, because they're temperature controlled. They're basically like little miniature refrigerators that you take with you that have all of the temperature loggers on it. They are in really high demand right now because everybody across the nation is trying to make these same processes work. So we identified some digital data loggers in Smyrna. We identified 8 transport coolers in Chattanooga. TEMA helped us identify those, and along with our National Guard partners, they got in a Black Hawk helicopter and flew that route between Smyrna and Chattanooga and got those pieces of equipment to Memphis around 3:45 on Wednesday afternoon. There is a period of where these pieces of equipment have to acclimate and get back to the right temperature. And so we did that overnight on Wednesday night. And then on Thursday morning is when the city of Memphis began using that equipment to oversee the sites and to make sure that the product got out to the site in a proper temperature. Then on Thursday, yesterday, we had completed the move of the physical inventory to both Regional One and Poplar Healthcare. We identified a need at Regional One where they needed an exclusive refrigeration unit for this vaccine. They have proper refrigeration, but they wanted to have a specific one just for this product. They didn't want it to mix with their own product. That's understandable. So again, very swift action by emergency procurement through our Department of General Services. TEMA and then our Department of Health Emergency Preparedness to not only purchase, but also move and install that refrigeration unit yesterday at Regional 1, where the physical inventory of the Pfizer product remains. We also had some pretty startling discoveries as the day progressed yesterday. This is new information that I'll draw your attention to, beginning with February 25th, where our team found 18 unused doses that were wasted after a vaccination event. And while that might not be so startling on the surface, the thing that was concerning to us is that these 3 vials, so 18 doses, were mixed in with some other vials and did not match up with the site where they went. We don't exactly know the date of those. We believe they were from an event on Monday, the 22nd, but we did have another 18 unused doses or 3 vials that we found yesterday that are somewhat unknown or scarce on details. The other 2 things that happened yesterday were also significantly concerning and have taken this investigation to a different level. So I had a conversation with Mayor Harris. I believe it was after lunch or early afternoon yesterday, and we were sort of running the list of here are the issues and here are the action items. And I alerted him to an issue that our ground team heard about on site, but didn't have any details at the time. And that was about a potential theft of vaccine by a volunteer at one of the sites. That was the Pipkin site. And when I mentioned that to Mayor Harris, he did acknowledge being aware of that. He didn't have any details immediately on him, but committed to providing me with details about that, which he did. He responded within the hour with some email information. And the email information contained some details about the potential theft at the Pipkin site by a volunteer on the February 3rd date. So yesterday was February 25th. It was the first time we had been made aware of this potential theft on February 3rd. To our knowledge, and in the documentation provided by Mayor Harris, that was not reported to any state or federal authorities. In the course of the documentation that Mayor Harris provided me yesterday, there was also mention of another incident that was made known to us for the first time yesterday, and that was an incident at the Appling site that also happened on February 3rd, where 2 children received vaccinations inappropriately. They were children that apparently had appointments, and the volunteer at the site, because there was an appointment, this volunteer gave the children the vaccine. This was reported internally with the management of the site, but was not reported to the state until yesterday. So late yesterday afternoon, pursuant to the knowledge about the potential theft of this federal resource, I did have to alert Mayor Harris that we had to report this to the Federal Bureau of Investigation, or FBI. My general counsel did that last night. I believe those conversations continue today. And so there will likely be quite a bit more information and questions coming forth from that report. So that's the timeline as of last night. And then before we stop with the timeline, I want to go through just a summary of the notable events of mismanagement. This is the last page in the packet of the timeline that we provided to you. So one of the more important pieces is when these expired events took place, or the events of the expiration took place. It was initially intimated that the bulk of the expiration was weather related. I believe this timeline will very clearly prove that it was not weather related, beginning on February 3rd, where 1,056 doses were expired on that date. At least that was the date it was noted. What you will see is that in the documentation that I provided you as a partial records request response, you will see the level of reporting that we received or lack thereof, and I will let you look at that documentation and see what we got. So on February 3rd, there was an expiration of 1,056 doses. If memory serves, the beginning of the ice storm in West Tennessee was on February 11th. So this was a full week prior to the first weather event. Also on February 3rd were the 2 incidents that I just mentioned of the Appling site vaccinating children and the Pipkin site with the potential theft. neither of which were reported to state or federal authorities. Then you can see expiration events on February 9th, 10th, 12th, 14th, and 15th. The one on the 15th is the 840 doses that was not disclosed to us until we talked about a federal investigation. There are 2 dates on that timeline with unknown dates. One of 78 doses that we believe may have been February 15th, but are uncertain. And then I referenced the wastage of the 18 doses that came back from a pod that we weren't entirely certain about, perhaps February 22nd. And then finally, February 23rd, when the 64 doses came back, that was supposed to be 76, still 12 doses unaccounted for. That was a lot of technical detail. I understand that, but I thought it was important to provide that clarity for you. Couple of more comments, and then I will stop for questions. I know I've used up most of the time, and I apologize for that. So let me tell you about what's happening as far as next steps. We continue as the State Department of Health in having a presence on site that will continue for the foreseeable future. The management and distribution of the vaccine is continuing to be handled by the city of Memphis and the task force. They have a joint allocation process, which seems to be quite effective, where they come to the table together, and with hospitals and clinics and pharmacies, that will continue. I mentioned to you that I was notified last night of the CDC coming on site. I don't have a timeline on that yet, but that is a next step. Otherwise, next steps include our ongoing involvement with the FBI, as well as CDC and entity formerly known as Operation Warp Speed. But I want to reassure you, and particularly reassure everyone in Shelby County, that all along my non-negotiable has been, we will not slow down vaccination efforts. As long as we believe it is safe and it is effective, we will honor the appointments, we will honor the schedule and the events, because the only thing worse than what we've got going on is actually slowing down getting needles in arms. And I'm sure everybody on this call acknowledges that and agrees with that. So we will not slow down in our vaccination efforts. That was a lot of information. I have 2 other really quick updates, and then Shelly, I'll open it up for questions. Effective Sunday, February 28th, is when our nursing home visitation guidance will change. I referenced that earlier in the week. I do want to set a little context and give some clarity there. That does not mean that every nursing home or long-term care facility will be open season and will fling their doors open on Sunday or Monday and anybody can come in. Individual facilities will still have their own policies, particularly those not under the purview of CMS, Medicare and Medicaid services. They will have their own facility guidance, and most of the time they will be using the state's framework that is expiring at the end of this week to inform their own policies going forward. Compare that to the nursing homes and skilled nursing facilities who are under the jurisdiction of CMS. They will continue with those CMS guidelines. Those CMS guidelines are posted on our website as well as on the internet, and so you can look for those there. And then finally, the FDA is meeting beginning today and will be meeting throughout the weekend, including ACIP on the Johnson & Johnson product. We do anticipate having Johnson & Johnson product in state perhaps as early as Monday. A lot of that is subject to what the decision is by FDA, but I do anticipate having J&J on site in the state next week. Shelly, I apologize for the lengthy comments. I'm happy to take questions now.
Yes, ma'am. Our first question will be from Caleb Kern at WCYD.
Yeah, Dr. Piercey, talking about the Johnson & Johnson vaccine, what kind of a difference is that going to make for vaccinations in Tennessee as far as how fast progress happens? And is there any consideration of giving folks the option of which vaccine they want?
So that's a great question, and certainly a hot topic of discussion on our end of things right now. As far as supply goes, we've been made aware of a little bit of an interesting quirk with the J&J supply chain. They have told us to anticipate the majority of J&J vaccine will be backloaded into the commitment through June 30th. So essentially it will start out as a pretty slow trickle. We've also been told that it might actually, after the initial allocation, it might go down before it goes back up. So we don't have clear optics on how much supply we're going to be getting just yet, but are relatively assured that we will get perhaps as much as 40,000 doses next week. Do not have confirmation of that yet. As far as vaccine selection or product selection, with any of our sites, they should, not only our sites, but any site for that matter, they should be able to tell you which product they have available. And so consumers and patients and citizens can make an informed choice about which product they want. So if we offer that in our health departments, we've got quite a bit of Pfizer and Moderna right now, but if we do decide to offer that in our own health department, we will be able to give consumers an informed choice. If we send it out to other providers, they will be telling their folks what they can get there.
Thank you. Our next question is from Brad Broder at Local Memphis.
Dr. Piercey, good afternoon. Thanks for taking the time again. I just would like sort of to get your response. There's been we've had news conferences this week. Mayor Harris was talking about we were stockpiling it because we were saving it for the teachers. A similar comment from the health director. I know you released a statement Wednesday, kind of saying that's a major violation. Is there a specific penalty for that? And just if you could kind of just comment on that, and I have a follow up.
I think the biggest penalty of any type of excess inventory, whether it was intentionally or unintentionally held throughout the month of January, as my timeline reflects, I think the biggest penalty is that by necessity, it withheld doses from the elderly. And you've heard me say many, many times that the elderly are at the highest risk for both hospitalization and death. And when it is a zero-sum game, there is a limited supply. If it is held in stockpile or in excess inventory, it is by default not getting into the arm of an elderly individual who desperately needs it. That would be the biggest penalty in my mind.
And thanks. And a quick follow up. What are your initial impressions of the city of Memphis taking over the operations? And is there any thing you could elaborate on about the FBI's role and just your reaction to these two major bombshells that you just outlined a couple of minutes ago?
So Mayor Strickland provided me and the governor with a pretty detailed rundown late last night about numbers vaccinated on site, projections of numbers that are expected to be vaccinated within the next week. The numbers were really impressive. There were several of them. I don't have them off the top of my head, but I believe yesterday's number was 6,900 that the city of Memphis oversaw, including well over 2,000 teacher vaccinations. That was music to my ears. It was a credit to the city in how quickly they responded. He was quick to point out not everything went perfectly. We didn't expect everything to go perfectly. They are committed to iterating and improving their process. So I've been very pleased with how that partnership has kicked off. Related to the FBI, I'm certain that you're aware I cannot disclose a lot of information about that ongoing investigation. I can confirm that it was a volunteer. It was not an employee of the Shelby County Health Department. It was a volunteer at one of their sites, and that volunteer is no longer working at that site or any of the sites to my knowledge. I have provided all of the rest of the information that I have to my counsel, who is providing that to the FBI, maybe even as we speak.
Thank you. Next up is a question from Kimberly Crucy with the AP.
Hi, Dr. Piercey. I guess I know you can't talk too much about the FBI. I was curious, can you confirm though that they have launched an investigation? And can you talk a little bit about the extent of the theft at all?
So what I can tell you about the investigation process is that our counsel touched base with the agent last night. They made a plan to speak today. I'm unsure what time they were speaking today. And so that information, and I will admit, we have a very limited amount of information, but what we have is being turned over to them. I really can't give any more details about the potential theft other than we believe it was already drawn up in syringes, that it was not vials, it was actually drawn up in syringes, and that the volunteer appeared to leave the site with some syringes. That's all I can say right now.
And quickly, I have a question regarding the two children that were given the vaccine. I guess that seems rather alarming to me since that has not been approved for children yet. Can you talk a little bit about what the state is doing to check up? Like, have you been able to identify the kids? Are they going to get a second dose? Like, what's going on with those kids?
So I really have no details on that because that was completely unknown to me until that was attached in the email that Mayor Harris responded to me regarding the potential theft. I was completely unaware of the childhood vaccine incident. What is already available is an incident report that was completed, and I will note it was completed in a timely fashion. Right after that incident was identified, it was a mother and 2 children. The children reportedly had an appointment. I'm unsure how they were able to get an appointment, but that's what was documented in the incident report, and that the volunteer who was on site gave the vaccine because the volunteer believed that that is what he or she was supposed to do if the person had an appointment. I don't recall that there were any names in that. I'm unsure if we even know who that is right now. I don't have any visibility on whether that was reported in the VAERS system, which so anytime there is a vaccine adverse event or variant, it is to be reported in that site. I'm unsure if it was even put into that system.
Thank you. Our next question, and it will probably be the last one, is from Blake Farmer at WPLN.
Well, then I will just ask this. You mentioned this. I think the term was low accountability organization. I mean, all of this kind of coming to light now. It's hard to imagine you all didn't have some sense that things were not going well. I mean, you say now that in late January you were, but like what is the future for this organization? I mean, who is responsible for sort of tidying things up, getting things turned around?
It's a fair question and one that's been in my head for a week now. And the only way I can answer that question is to interpret it as how I would think about myself if this happened in one of our rural health departments. And so at the end of the day, the leader is accountable for making sure what he or she is hearing and being told is accurate and complete. That appears to be the main issue at hand here. Not only was the leadership there being told everything's okay, we don't have any evidence that they actually verified that for themselves. We don't see any process for accountability or confirmation there. So at the end of the day, there does appear to be a lack of accountability and in some sense leadership, which has undoubtedly potentially harmed some folks and withheld vaccine from people who needed it.
Dr. Piercey, do you have time for one more?
One more quick one. I was supposed to have a hard stop at 12:10.
Okay, we'll take Jacob Stammer then from the Memphis Business Journal.
Yeah, thank you. I'm just curious. Sorry. Can you walk us through? You said the 850 were not reported until you told them there'd be a federal investigation. Did they explain that at all? Or do you have any more information about why they chose to withhold that? Or if they didn't know about it previously?
Jacob, you and I share the same question. I don't know why they didn't disclose it until we mentioned a federal investigation.
Thank you. That is all the time that we have today. I know we have several questions in the queue. Please email those to us at tdhmedia@tn.gov, and we'll be glad to work on responses for you. Thanks everybody for joining us this afternoon. Also, if you did not receive the documents that we sent to you, please send us an email. We'll be glad to provide those to you. We will be planning some additional briefings next week, so be on the lookout for the invitation for those. Thanks so much and have a great afternoon.